de la santé publique à l'Agence de la santé publique du Canada. Following the remarks, we will open the teleconference line for questions from the media. Suite à la présentation, nous répondrons à vos questions. If you wish to ask a question, please press star 1 on your phone. Si vous désirez poser une question, veuillez appuyer sur étoile 1. Nous procédons maintenant au point de presse. Let's begin today's media availability. Over to you, Dr. Tam.
Thank you, and good afternoon, everyone. This is Dr. Theresa Tam, Canada's Chief Public Health Officer. I would like to start by saying that following additional testing conducted by the Public Health Agency of Canada's National Microbiology Laboratory, we can now confirm that the case previously announced by the province of Ontario is the first confirmed travel-related case of the novel coronavirus in Canada. Ontario reported earlier today that the spouse of the first confirmed case has tested positive for the virus. I continue to be in close contact with all provincial and territorial chief medical officers of health, and we will be setting up a federal, provincial, territorial special advisory committee on the novel coronavirus tomorrow that will help us work even closer together to monitor our preparedness and response activities across Canada. I would also like to thank Ontario for communicating Canada's second case. The province has indicated that this patient has already been isolated at home when their symptoms appeared, and they have been managed with all appropriate infection and prevention control protocols, so the risk of spreading the virus to others in Canada is low. The second case is consistent with what we are seeing in that transmission of the virus is occurring among family members who have had close and prolonged exposure with sick individuals. Canadians should not be concerned that they can pick up the virus from an infected individual by any casual contact, such as walking through the airport or another public place. Just like any virus, such as the flu, we encourage Canadians to stay home if they're sick. Wash your hands often. Sneeze into the bend of your arm or your sleeve if you don't have a Kleenex tissue, and ensure your vaccines are up to date to avoid other infectious diseases that are preventable through vaccination. Given global travel patterns, it would not be unexpected to have more cases reported in our country in the coming days. Our top priority is the health and safety of Canadians. Canada's disease prevention control systems are designed to quickly detect and contain infectious diseases. I want to reiterate that Canada has a number of standard border measures in place to mitigate the potential risk of introduction and onward spread of communicable diseases into Canada. In addition, there are messages on arrival screens at the Toronto, Montreal, and Vancouver airports, advising travelers from Wuhan to inform a border service officer if they are experiencing flu-like symptoms. There is an additional screening question on the electronic custom kiosk upon entry, and those who are ill will be referred to hospitals for testing. An information handout is provided to those who are well upon arrival. It is important to know that entry screening alone is not a guarantee against the possible importation of this new virus, but is an important public health tool during periods of uncertainty and part of a multi-layered government response strategy. To ensure clarity on our border measures, I want to clarify that screening procedures were in place at the airport when the first confirmed cases arrived in Toronto. We can confirm that both the husband and wife did complete arrival questionnaires at the electronic kiosk, indicating that they had traveled to Wuhan. As a result, they were questioned by a CBSA agent, a Canada Border Services agent, to determine if they had symptoms consistent with the novel coronavirus. At the time of arrival, the husband had only mild cough. Both were then provided with information on what to do if they fell ill over the next 14 days. This information is what allowed them to quickly contact a health provider ahead of time when their illness became consistent with the novel coronavirus disease. We understand that other passengers who were on the same flight will have concerns. I can tell you that the flight was China Southern Airlines flight number CZ311 from Guangzhou that arrived in Toronto at 4:30 p.m. on the 22nd of January. We are working closely with Ontario health authorities who are following up with travelers who may have been exposed to the case on the flight. Canada will maintain and enhance our border measures, including increasing the presence of our public health offices of public health in Vancouver, Toronto, and Montreal to support the Canada Border Services Agency. As there is often a lot of misinformation circulating, and that this can lead to undue concern, I encourage Canadians to use credible sources such as the Government of Canada website at canada.ca/coronavirus for the latest information on this novel coronavirus, including steps to protect themselves from infectious diseases. We have also just today added a series of frequently asked questions. The Public Health Agency of Canada will continue to collaborate with public health authorities and international partners to limit the spread of novel coronavirus in Canada. We will keep Canadians informed as new information becomes available. Thank you.
We will now open the telephone line to questions. Please identify yourself and the media outlet you're representing. We will be taking questions in both official languages. We ask that you limit yourself to one question and only one follow-up. Veuillez vous nommer et nous dire quel média vous représentez. Nous vous demandons de vous limiter à une question et seulement une question de suivi. Vous pouvez poser vos questions dans l'une des deux langues officielles. Operator, over to you.
Thank you, merci. Please press star 1 at this time if you have a question. S'il vous plaît, appuyez sur l'étoile maintenant pour poser une question. And the first question is from Heather Urix-West from Global National. La première question vient de Heather Urix-West de Global National. Your line is now open. La parole est à vous.
Hi, everyone. I just want some clarification. Over the weekend, we heard from Chinese health officials that this virus could be spread before a patient was symptomatic. What are you hearing from the WHO at this time, and what advice are you giving provincial health officials with regards to how this virus spreads?
I think obviously this is, some of the publications I think you're referring to just recently. So we do have to obviously go back to have this information verified. But so far, we haven't seen any clear evidence of patients being infectious before symptom onset. So that basically is what we have so far. But obviously, this is a virus that we're still learning about. Well, I can say, though, that coronaviruses and respiratory viruses, even if they do spread during the mildly symptomatic period, you're most infectious when you're actually symptomatic and when you're really sick. Nonetheless, it is important to continue to investigate this particular question. But again, no, there hasn't been any clear evidence of patients being infectious before symptom onset.
Merci. Thank you. Next question is from Tom Blackwell from the National Post. La prochaine question vient de Tom Blackwell du National Post. Please go ahead. Your line is open.
Hi, thank you for this. I wonder if you could expand on what exactly happened with the screening of the one confirmed case and his wife. As I understand from what you said on the electronic questionnaire, they indicated that they had been in Wuhan, and then they were taken aside and questioned about that, but still cleared through. I guess was it a CBSA officer who questioned them, and were they truthful about the symptoms that the husband was experiencing, or how did that happen exactly?
After answering to the question at the kiosk, they would have been referred to the border service agent. As far as information I have, the first case, the husband said that he had a bit of a cough. He was not visibly ill. I think that's the key. And so they were then provided with the necessary information to know what to do should they get sick. So it wasn't until they fell ill over the next day, I believe, that he then contacted the health system. So the advantage is exactly what happens retrospectively. That's what we gathered.
Well, do you think that was handled appropriately by that officer? And sort of related to that, I was told by CBSA, though, that anyone who has symptoms like this are referred to public health agency staff, but that sounds like that's not the case. Anyways, I mean, what did this officer handle it correctly? And are there public health agency staff at the airports to do this kind of questioning?
Certainly, the Public Health Agency is there to support the Border Service agent should that be needed. But I think based on what I know of the scenario is, of course, many people who come off a plane might have symptoms. But I believe that this passenger reported a bit of a cough, but was really not visibly ill in any way. So I think that's a very reasonable approach, but obviously they actually understood what they needed to do so they got sick. So I think from our perspective, that approach.
Okay, thank you.
The next question is from Carla Weeks from the Globe and Mail. La question suivante est de Carla Weeks du Globe and Mail.
Hi, and thank you for taking my question. I wanted to ask about the enhanced presence of public health officials at airports. Could you please provide some details about what that means exactly in terms of, what we're going to be seeing at those airports?
I think, obviously at the border, which, as I said, is one layer of a multi-layer strategy, I think our public health staff will be there, obviously assisting the CBSA officers in their screening approaches. But I think just as importantly is there to provide information to passengers from the flights that are from China. So I think, enhancing that presence.
So specifically that, at this point, are there staff in those airports, and will this be sort of a change to bring them in? I just wanted to be clear on that point, whether this is sort of a change that's happening.
It's just increasing the numbers.
Increasing numbers. And is there any, is this in response to the fact that the man who had very mild symptoms was sent home? I mean, there's obviously been questions about the effectiveness of the screening.
For us, I think that this is certainly just to provide more capacity to provide the necessary support to passengers and to our border service agents. So I think it's really based on assessment of the need, but due to what we've seen so far. But
Okay,
in terms of the type of work support that's required.
Okay, thank you.
Thank you.